Have you ever wondered what you would do if the use of medications affected your mood or thinking ability? Or what if the things you are feeling aren't actually there? These questions might seem strange, but for some people, this is their daily reality. If you want to know how this is possible, you are watching the right video. Today, we're going to discuss a special condition of mental health called mood disorders and psychosis, caused by the use of substances. It's a topic that is not often openly discussed, but it's important to understand. So let's delve deeper into it. Firstly, we will look into what is this? How many types are there? What are the symptoms? What causes it? What are the treatment options? And finally, the conclusion. First, we will understand what is substance-induced mood disorders and psychosis. Let's see. Substance-induced mood disorders and psychosis are two mental states caused by the use of drugs or intoxicating substances, which not only alter your mood, but also affect your ability to think and understand reality. This makes it difficult for the individual to understand themselves and the world. I hope you now have a bit of an idea about substance-induced mood disorders and psychosis. Let's move on to the next point, where we will learn about its types. Let's look at its types and understand them one by one. First, we look at the types of mood disorders. It has two main types. First, major depressive disorder. This occurs when someone is in deep sadness or despair. Second, bipolar disorder. This involves extreme fluctuations in mood, such as intense happiness followed by deep sadness. We look at the types of psychotic disorders. It also has two main types. First, brief psychotic disorder. This is a short but intense psychotic episode. Second, schizophreniform disorder. This has symptoms similar to schizophrenia but lasts for a few months. Friends, these were some of the common types of substance-induced mood disorders and psychosis. Now, let's move to the next point, where we will learn about its symptoms. Substance-induced mood disorders and psychosis has many symptoms, but in this video, we have covered some common ones. Here are a few common symptoms of substance-induced mood disorders and psychosis. First, we look at the symptoms of mood disorders, such as severe mood swings. In this condition, someone's mood can be extremely high or low, which is very different from their usual behavior. These changes can happen suddenly and affect everyday life. Next, changes in energy. Sometimes a person may seem very active and energetic and suddenly feel exhausted. This can affect their work and personal life. Next, difficulty in concentrating. Difficulty focusing and confusion in thought can make it hard to perform at work or make daily decisions. Next, thoughts of suicide. Due to deep sadness or despair, some people may contemplate or attempt suicide. We look at the symptoms of psychotic disorders, such as hallucinations. The person might hear, see, feel, or smell things that aren't really there. These hallucinations seem very real and are often frightening. Next, delusions. In delusion, the person believes in thoughts or beliefs that are disconnected from reality. For example, they might think someone is plotting against them or that they are on a special mission. Next, disorganized thoughts. This symptom includes scattered and disordered speech, making it difficult to communicate with others. Next, social withdrawal. In tough situations, a person might stop interacting with others and prefer to be alone, affecting their social life. Next, neglect of personal hygiene. In this condition, a person may not take care of their cleanliness. They might not bathe regularly, change clothes, or perform other personal hygiene tasks. So, friends, those were some common symptoms of substance-induced mood disorders and psychosis. If you have information about any other symptoms, please write them in the comment box. Now, let's move on to the next point. What are the causes of substance-induced mood disorders and psychosis? Let's see. Substance-induced mood disorders and psychosis have some main causes, such as substance use. It has two categories. First, alcohol. Excessive drinking can negatively affect the brain, causing sadness or anxiety. Second, illegal drugs. Substances like cocaine, heroin, and methamphetamine disrupt brain chemicals, leading to mood disturbances and psychotic symptoms. Next, genetic factors. If someone in the family has had mood disorders or psychotic symptoms, it might appear in other family members as well. Next, psychological stress. High stress or a major shock can also promote these disorders. This stress can come from major accidents, divorce, or changing jobs. Next, environmental influences. A negative environment, such as abuse, neglect, or isolation, can also lead to mood and psychotic disorders. Next, neurobiological factors. Imbalance in neurotransmitters in the brain can also cause mood and psychotic disorders. The disruption of chemicals like dopamine and serotonin could be a reason. Next, personality traits. Certain personality traits, such as impulsiveness or getting easily upset, can make a person more susceptible to the use of substances and their consequences. These were some common causes. Now let's move on to the important points, where we will learn how it is treated. Substance-induced mood disorders and psychosis can be treated in several ways. Let's see. Treatment of mood disorder, such as antidepressants. These medications adjust chemicals in the brain, reducing sadness, despair, and fatigue, improving daily routines and life quality. Next, mood stabilizers. Used in bipolar disorder, these medications control mood fluctuations, aiming to keep the mood stable and prevent extreme ups and downs. Treatment of psychotic disorder, such as antipsychotics. These medications are used to reduce symptoms like hallucinations and delusions, correcting chemicals in the brain and improving thinking and behavior. Next, psychotherapy. In this, therapists help the individual understand their thoughts and emotions. This therapy helps improve behavior and social interactions. Next, supportive therapy. This therapy aids in improving social skills and support. It includes group therapy sessions and community-based support groups, assisting individuals in their recovery journey. Friends, these were the methods to treat substance-induced mood disorders and psychosis. If you feel any point was missing in this video, please do let us know in the comment section. Finally, let's look at the conclusion. Friends, substance-induced mood disorders and psychosis can create significant obstacles in life, but with the right information and timely treatment, they can be managed. So do not hesitate to seek help for yourself and your loved ones. Stay with us for more informative videos. If you liked the video, please like, comment, subscribe, and don't forget to hit the notification bell so you don't miss our upcoming videos. We'll meet again in the next video. Until then, stay happy and take care. Thank you.